from the lens of metabolic or mitochondrial dysfunction, which leads me into a question that we got, I think that ties in nicely. It's like, so how can a practitioner avail themselves of the diagnostics and the treatment modalities in the study? Or I think, Dr. Katiraei, you can speak to this because you're already doing it and have been doing it without the benefit of the study.
We are members of a community, and I'll let Dr. Katiraei discuss about that community.
Yeah, so I believe we overcomplicate the diagnoses of these children in terms of working them up, where people feel like, you know what, we have to get the mitoswab, we have to get organic acids, and you have to know how to read all of these tests to make sense of them to be able to help these children. And I think the beauty of Spectrum Needs, and really the entire conversation over here, is any provider anywhere without a lot of experience can actually use this product to help these kids, because if the child presents with fatigue, they present with low tone, they also happen to have, poor eye contact, poor socialization, poor communication, etc., chances are that's a child that would benefit from this product. Would you agree?
I agree.
If we simplify it and distill it down to what are signs and symptoms of a metabolic error, which are some of these things, right? Low tone, the child is clumsy, they fall, they wake up tired, they get tired during the day, etc., etc., etc. If we distill it down to what are we treating and how do you see that in real life without fancy testing that not everyone is comfortable doing or able to do, right? I think that's the power and beauty of this conversation. You've got a very accessible product that's not inherently expensive for what it is. And you don't need fancy testing and complicated diagnoses to be able to utilize it. And I think one of the things Dr. Boles talked about is the safety profile for this supplement is rather great. There are some children who can't tolerate the methylation, right? So there are a small subset of kids that may get more hyper when they take it. But for other children, especially those that are groggy and tired and listless and just exhausted, those are generally the kids that do really well.
As always, consult your physician before trying any of our products. For more information, visit NeuroNeeds.com. We would appreciate it if you would like, share, and subscribe. Thanks for being part of our journey.